Hello everyone, my name is Brittany Rossi and this video is for my nursing informatics class. The topic that I will be covering today is stroke prevention. A stroke is the fourth leading cause of death in the United States and 80% of strokes can be prevented. I'm currently employed in the ICU at Penn Highlands Du Bois. On the unit we care for many stroke patients, and if they aren't necessarily a stroke patient, many of our patients do have the associated risk factors that go along with a stroke. I have a patient here today and his wife. He has some of those risk factors, so we will be doing some stroke education. I have a pamphlet and a booklet here that he will be able to take home. We will be going through those, talking about what a stroke is, some of the associated risk factors, what the patient can do to help prevent a stroke, and some warning signs and symptoms. So I'm going to get started with my patient here. Alrighty, let's get started. I'm going to start with what a stroke is. If you have any questions along the way, don't hesitate to ask. A stroke is a brain attack that cuts off blood flow and oxygen to the brain. When this happens, brain cells begin to die and brain damage occurs. Strokes can be caused by vessels getting blocked. 87% of strokes are from a blockage in the brain, so obviously this is the most common type you'll see. Strokes can also be caused by a vessel that breaks, causing bleeding in the brain. There's also what's called a transient ischemic attack, a TIA. It's also labeled as a mini stroke. They are temporary and only last a short time, usually causing no permanent brain damage. They are serious, so you want to call 911 immediately if you think you're having one. 1 in 3 people that have a TIA will eventually have a stroke, so prevention is key. Any questions on the different type of strokes I just went over? Alright, let's move on to risk factors. Anyone can have a stroke at any age. Your chance of having a stroke increases if you have any of the following risk factors: high blood pressure, irregular heartbeat. A big irregular heartbeat that goes along with this is atrial fib. It's an irregular fast heartbeat. High cholesterol, diabetes, smoking, alcohol drinking, if you're overweight, lack of exercise, family history, age over 55, previous history of a stroke or a mini stroke, coronary artery disease, and sleep apnea. Any questions on the following risk factors? All right, let's move on. So what you can do as the patient to help prevent a stroke. I know you smoke, so stop smoking is a big one. There's many different things that can help. You can go as far as a nicotine patch, smoking cessation classes. There's some medications that will help you, so we could get you some of that information after we're done if you'd like. Limiting your alcohol intake, controlling your blood pressure. Diet and exercise is a huge one that we see a lot in our patients that don't do. So exercising, that could include walking 30 minutes a day if you're able to do that. Diet-wise, you want to limit your fats and your sodiums. You want to decrease stress. You want to learn about your risk factors. Talk with your doctor, and don't be afraid to ask questions. You always want to ask questions. Any questions there? All right, some warning signs and symptoms. If you have any trouble walking, dizziness, problems with balance, a severe headache that is unknown and won't go away, numbness, weakness, or tingling on one side, trouble with your vision. There's an acronym called FAST. F is for face, A is for arms, S is for speech, and T is for time. Face-wise, you want to look for if one of the side of your face is drooping. Arms, you want to ask the person to raise both arms and see if one of the arms drifts downwards. Speech, if you can't make out what they're saying. Slurred is a big sign. And time. If you observe any of these signs, you want to call 911 immediately. I can't stress enough to my stroke patients, the first thing and the most important thing you could do is call 911 right away. You do not want to wait. Early treatment for stroke increases your chance to survival and minimize disability. Many treatments for stroke, such as a clot-busting drug or clot-removing procedure, have time limits, so you do not want to wait. Many people with strokes do not get to the hospital in time for the right treatment. So time is brain and every second counts. Not all patients are able to receive the clot-busting drug or have procedures, but still call 911 no matter what. Is there any more questions that I can answer for you today? I appreciate you sitting here and listening to me. Please do not hesitate to ask if you have any questions with the rest of your stay here. Nobody wants to have a stroke, so reducing your risk is key. Making healthy lifestyle changes is important in getting support from your family and friends. And you never want to be afraid to ask questions. I hope you all enjoyed my video and you all have a wonderful day.